like all of us are a little bit dead while we're alive. That's what metabolic dysfunction is. It's less energy in the body. We're underpowered. And that's very dark. And then look around at what is happening to American health, children's health, health across the lifespan, as well as global health. It's a disaster. It's literally a disaster. We are getting destroyed, and it's very recent, and it's accelerating. The stats speak for themselves. 74% of Americans are overweight or obese. 50% now of American adults have type 2 diabetes or prediabetes. These were diseases where there was 1% of Americans in 1950 had type 2 diabetes. Now it's 50% of Americans have prediabetes or type 2 diabetes. Alzheimer's dementia are going through the roof. Young adult dementias have increased like 3 times since 2012. So early onset dementias, we're seeing 1 in 2 Americans are expected to have cancer in their lifetime now. 1 in 2, and young adult cancers are going up 79% in the last 10 years. We've got, of course, the autism rates are absolutely astronomical. 1 in 36 children has autism now in the United States. That was 1 in 150 in the year 2000. And in California, where I live, it's 1 in 22. 1 in 22 with a lifetime neurodevelopmental disorder. We've got infertility going up 1% per year. 25% of men now under 40 have erectile dysfunction. A quarter of the country. This is fundamentally a metabolic disease. We've got 77% of young Americans can't serve in the military because of obesity or drug abuse. We've got autoimmune diseases. Some studies are saying they're going up 13% per year. We've got heart disease, which is almost totally preventable, as the leading cause of death in the United States, killing around 800,000 people per year. I started trying to put the pieces together. Why is this happening? Why are these all going up all at once? And that led me on what is now a 7-8 year journey, ultimately leaving the surgical world, putting down my scalpel forever. If not, how do I treat the diseases once they emerge, but why are they happening? You see a very obvious, blaring answer, which is that it's all caused by metabolic dysfunction, a term that I never learned in medical school. But there is a problem. There is a fundamental breaking of our core cellular biology that is caused by our diet and the world we're living in, the modern world we're living in today, that is crushing the very way that the human body and our human cells can transmit food energy to life energy, to cellular energy. It's basically like all of us are a little bit dead while we're alive. That's what metabolic dysfunction is. It's less energy in the body. We're underpowered. And that's very dark. Like when you step back and say, okay, this is clear from the research, and I never learned it. I didn't learn it at Stanford Medical School. I didn't learn it in my surgical residency. And we could fix it. We could fix it really quickly if we all popped up and woke up and looked at the data and put pieces together. But of course, we're not trained to connect dots. That's not our job in medicine. We are trained to follow algorithms and to be reactive.